My question is probably more an economic one, and it's great that we're able to prolong life and make things better for everybody. And you can get a certificate from the doctor to say you're terminal and your insurance pay out. Once that payout's finished, you then have another economic situation for your family. It's like, well, this is getting more expensive, and I'm still healthy. Can I get a certificate from the hospital system to say that I'm healthy enough to work at least part-time, rather than just saying, okay, I've got to go on a pension now, or if you qualify for a pension. I was just wondering, is that a pathway? Is that something that can happen?
We've had situations where people outlive their prognosis by long. I would certainly involve the social worker in those sort of discussions, because there might be some updates that I may not be aware of. But yes, in some settings, especially in the breast cancer, there are certainly situations where people will do much better than initially anticipated. We tend to sort of avoid and not be too specific when asked about the prognosis, just because we know that we can't predict it that well, and the statistics really don't apply to those 5% or that are really far from the medians in the survival curves, even though it's incurable disease, especially if it's a ER positive, HER2 positive disease. Nowadays, we know that survival can be years. We make sure that these discussions about terminal clarify that it's not within 12 months, or it could be longer, and it is something that we may only be able to assess down the track when we see how the treatments work and what's going to happen later. But yes, I remember these sort of situations where we sort of thought that the survival would be fairly short, and then we have amazing response to treatment, and yeah, with the new drugs, with the immunotherapy, sometimes it could be years and years and years down the track.